Before you view our video, please take a moment to subscribe our channel by clicking the subscribe button, then tapping the bell icon to never miss any update. Missed period, negative pregnancy test, top 7 causes. One of the most frustrating things a woman can experience is having a late period and a negative pregnancy test. If you continue to get a negative result on home pregnancy tests for more than a week after missing your period, it's very unlikely that you're pregnant. But it is possible to get a negative pregnancy test result when you are actually pregnant. Your ovaries normally release one egg every month or so, and if it's not fertilized, menstruation starts about 14 days after the egg is released. There are a few possible explanations. Indeed, in many cases, there may be explanations other than pregnancy for why your period is late or has gone missing. Taking a pregnancy test too early. You have some early pregnancy symptoms but have a negative test result. One of the most common reasons is that you have taken the pregnancy test too early. Many people think they can test for pregnancy right away, but it takes time. HCG can be detected in the urine only at a minimum of 2 weeks after conception occurs. Ectopic pregnancy. It's rare, but sometimes an ectopic pregnancy can show up as negative on a pregnancy test. This happens in less than 3% of ectopic pregnancies. Seek medical attention if you have these symptoms: severe pain low in your abdomen, dizziness, bleeding or spotting, nausea and vomiting. Thyroid problems. Your thyroid gland controls your body's metabolism. If this isn't working properly, it could interfere with your periods. A simple blood test can determine how well your thyroid is working, and thyroid conditions can usually be corrected with medication. Breastfeeding. New mothers who are breastfeeding often experience late periods, or no periods at all. This is due to the high levels of prolactin in their bodies. Prolactin is a hormone that establishes breast milk production, but it also suppresses the hormones associated with your menstrual cycle. Breastfeeding is associated with late periods. Emergency contraception. Emergency contraception is a high dose of progesterone, 0.75 mg of levonorgestrel, and it works by preventing or delaying ovulation and tubal transport. It is very similar to the progesterone a woman makes, which can impact the menstrual cycle, possibly delaying menstruation up to a week. Jet lag. If you've been traveling and have jet lag, it's common for you to have late periods. When you travel over different time zones in a short period of time, your body's natural rhythms, such as sleep and wake, are thrown off. And menstruation can also be messed up for a few days. Vigorous exercise. A common cause of late periods is too much exercise. Intense exercise regimens can stress out your reproductive system and lead to late periods and fertility problems. Moderate exercise, 30 minutes a day, is often the best way to keep your periods regular and stay healthy.